Hello, I'm Dr. David Cotter, a board-certified dermatologist practicing in Las Vegas at Las Vegas Dermatology. This year, at Derm 2026, I was fortunate to speak on how we can utilize clinical trial data to empower clinical decision-making for our patients with atopic dermatitis. We took a specific focus and a deep dive on the use of JAK inhibitors, particularly Upadacitinib, to treat our patients with atopic dermatitis. We've had this drug available clinically for 4.5 years, and at this point, I don't think anyone can question the efficacy of Upadacitinib when it comes to treating moderate to severe atopic dermatitis in patients 12 or older. Over and over again, whether we look at head-to-head studies against dupilumab or network meta-analyses that compare Upadacitinib to the entire treatment landscape of other AD, JAKs, and biologics, Upadacitinib over and over again comes out superior as the number one most effective medication we have on average for atopic dermatitis. Yet, they're still slow to adopt in some circles, JAK inhibitors in general. And the purpose of my talk was to help empower clinicians to overcome therapeutic inertia, to learn more about the safety and feel comfortable utilizing Upadacitinib to treat patients with atopic dermatitis. In addition to the clinical efficacy, which is gangbusters, even following out to multiple years on therapy, where we have very high levels of achievement of EASI-90, scores of clear, almost clear, NRS 0-1. We talked a lot about safety. Safety is so important because our patients ask us about that every day. When it comes to safety for any JAK inhibitor, including Upadacitinib, I always talk about the box warnings with my patients, and I let them know that this medicine has a box warning for things like heart attack and stroke, blood clot, cancer, serious infection, and even death. We especially want to avoid that last one. And in fact, with Upadacitinib, we generally avoid all of them, because when we look at large clinical trial data sets, we see that we have to have 1,000 or more patients on Upadacitinib for 1 year to see anywhere from 1 to 3 of those events. And as it turns out, if you follow a cohort of atopic dermatitis patients over time, you're going to see those unfortunate events at the same rates. What that means is when you look at the population-based incidence rates for these scary things that the box warning calls out, we don't see a difference in the rates between these two cohorts. And when I explain it to my patients, sometimes in a slower, more simple way, they ask me, well, why does it have the warning to begin with? And that's actually because of another medicine called tofacitinib, used to treat a different disease state, rheumatoid arthritis. In a surveillance safety study, that drug was compared to a TNF-alpha inhibitor. All of the patients were on background methotrexate and or prednisone. Many were on both. And they found that the safety between tofacitinib and TNF in that patient population wasn't different from one another. And because of that, all JAK inhibitors in dermatology came down with a class-wide box warning, which has only recently been challenged by a single JAK inhibitor used to treat chronic hand eczema in a very low body surface area manner, is the only one that doesn't have that class-wide box warning. But back to Upadacitinib, when we look at that drug to treat patients with AD, but not only atopic dermatitis, even across all FDA-approved indications, which includes rheumatoid arthritis, psoriatic arthritis, inflammatory bowel disease, atopic dermatitis, ankylosing spondylitis, non-radiographically active ACT-SPOND, pediatric juvenile idiopathic arthritis, and PEDS PSA down to age 2, and now giant cell arteritis, which is a population that is typically much older in their 70s that already have high-risk features for potentially having a cardiovascular event. Across the entire clinical trial program for Upadacitinib, we don't see high rates of any of these events associated with the box warnings. What we do see with Upadacitinib is, a little bit of acne. We see some herpes zoster, which is where I recommend that all of my patients get a shingles vaccine if they're going to go on Upadacitinib. And outside of that, it's been an incredible drug to treat our patients with atopic dermatitis, and I'd hate to see anyone not use it for a patient that needs it because of a misunderstanding of the true safety of this medicine. And that's why the talk is entitled Empowering Clinical Decision Making, because when you understand the clinical trial data, you can help guide your patients to make the appropriate choice for them.